Hi, so I'm going to talk to you about a quality improvement project I was involved in when I was a registrar. When I moved to Leeds Children's Hospital, one of the things I first noticed was that we often would have the day team handing over to us at night time routine blood tests to be done by the junior doctors. It was really hard work as the night team having all these extra jobs to do. And in addition, it was really bad for the patients because it often meant we'd have to start doing bloods quite early in the morning to get them done, so we'd have to wake them up. It's not a great way to be woken up. The parents might not be there, and we didn't have the play team around to help and offer support with distraction at that time. There was, however, a phlebotomy service that existed, but nobody could really tell me how it worked, if it worked weekends, and nobody really had a lot of faith in the service from a doctor point of view. However, our patients, when they're inpatients, would often say, "Oh, can't we just have our bloods done at outpatients if you give us the forms?" Because they had a lot of faith and trust in the phlebotomists and didn't have as much faith in the junior doctors that they didn't know. So I knew they must be doing something right. So I found that really frustrating. So the first thing we did was got together and had a chat with some people. So we had a meeting with some interested consultants and the phlebotomist and the head of phlebotomy, and that was really enlightening, and that's where we really understood how there was a lot of miscommunication and nobody really understood what was going on. We use something called a fishbone diagram, which is a way of just helping you look at a problem where you look at the different things that could be affecting it, such as the environment, the people involved, knowledges and equipment, to really look at all the problems that were there. And from that we developed our aim, which was that we wanted to reduce the number of bloods being done by junior doctors overnight that were routine to zero. We got a few balancing measures thrown back at us, so things that people were worried about that might go wrong with this. The phlebotomists were worried they might suddenly be inundated with loads of extra work, so we monitored if they got that done within the time they were allocated. The medical teams were worried that they were suddenly going to get forms handed back to them because they weren't going to have the skills to do it, so we therefore monitored how many forms were being handed back. And then we started the project after we collected some baseline data, so we knew that around 6 bloods per night were being done by junior doctors. We made our first PDSA cycle change, which was to pilot it on 4 wards, set out some clear rules and just really see how it went. With just those simple changes, we got it down to there being just 2 bloods per night being done by the junior doctors. So we met again, talked about what was going wrong, and actually it was mainly the ward I worked on that was the problem, because we needed to get bloods done by 10:30 in the morning to get them in a taxi to the labs for drug monitoring. So we made a change that the phlebotomist would always come to our ward first so that people would know they'd get done in time. With this change, we managed to get it down to just 1 blood per night, and we then rolled it out to the other medical wards in the children's hospital. A year later, things were going really well, so we were now rolled out to every ward in the hospital, including the surgical wards. We did a check for 2 weeks and we found there were still no bloods being done by the junior doctors, and we've now moved on to it being a twice-a-day service. It worked out really well for the phlebotomists because they've actually been able to increase the numbers of them that they employ because they've shown that there's a demand for their work, and they're now working closely together with the children's team in the play department to try and improve the experience further. So all in all, it was a really satisfying way to take something that you found frustrating and annoying and to be involved in changing it and see that change sustained and make the life better for both patients and the doctors working alongside.